If you can imagine, this is the human body. When we acquire a foreign protein, that protein could be a virus, a bacteria, a fungus, a mycobacteria, whatever that is. For the purpose of this talk, let's say this virus is COVID-19. This virus has a certain shape, a sort of a round side and another angular side right here. The virus will have inside it nucleic acid material. If it's a DNA or an RNA virus, it would have a DNA or RNA. When this virus or this foreign protein enters the body identifies that as an antigen. The body makes antibodies against this antigen. So these are formed by the body in this sequence. So IgM first is formed, and what that is this antibody is responsible for identifying the foreign protein, taking a picture of it if you want, and sending that picture to the bone marrow, telling the bone marrow, hey, we have a foreign protein that has invaded the body, and we need you to do something about it. Now the bone marrow starts making the other antibodies, the most important of which is the IgG. It makes large amounts of IgGs, and those IgGs are specific to that particular antigen, in that if we're going to draw it, we could draw something that looks like this, and another IgG could look like this. And so what these do is they would go and attach to that virus in different locations. This IgG1 would go and attach right here. This would go and attach itself right here. This is called an antigen-antibody complex, and it would kill the actual antigen. One of the important things that it does also, it leaves you with these IgGs for the future, so that we have a lot of these present. If in the future this virus tries to come and infect you, well, you have these already present, and you don't need to go through that cycle again. So what is a vaccine? A vaccine is simply, again, simplifying things. If we take the shell of this virus, we manufacture this shell, and we remove the inside of it, basically. We remove the DNA or the RNA, and we give it to the body. And so the body thinks there's a virus, and it goes through this process, and it forms these IgGs, these antibodies. And so in the future, if the actual virus tries to infect you, you already have these pre-manufactured immunoglobulins, IgGs, that will go and attach to the virus this time, making the infection less aggressive or no infection at all.